So the mainstay of managing these patients is supportive care for their lung infections. Many of them are on chronic antibiotic usage. And because they have low immunoglobulins, a lot of them are on immunoglobulin replacement therapy with IVIG or subcutaneous immunoglobulins. And some patients also require mTOR inhibitor like Sirolimus or Everolimus to manage their lymphoproliferation. And we have some patients on that medication at NIH also. However, Leniolisib is unique in the sense Leniolisib is specifically targeting the genetic defect of this disease, whereas Sirolimus is doing global immunosuppression, immunomodulation. So, and Sirolimus has its own side effects we have to deal with. And some patients tolerate, some patients don't tolerate. So Leniolisib, I think, is a better option right now. The other option that has been tried by many of my colleagues and advocated by many in Europe is bone marrow transplantation. And yes, bone marrow transplantation can cure this disease, but bone marrow transplantation is not a walk in the park. It is not without its own risk factors. And if you, first of all, the challenge is to find the donor. If there is a sibling donor that you are trying to use for bone marrow transplantation, you have to make sure the same genetic defect is not there in the sibling. And if you want to take a unrelated donor, they need to be properly matched, fully matched. And if you, the more and more you go away from fully matched, then you have to give proper conditioning, and that has its risks. And then we have also noticed, and there have been published literature already, that bone marrow transplantation in this particular disease is very challenging because it involves significant amount of graft failure. So I don't think bone marrow transplantation is the entire answer for this condition. And many of the patients are not being recognized readily. Sometimes they get diagnosed after they get their lymphoma, get treated for lymphoma, and then somebody thinks about this disease. So it is very important to take adequate family history and adequate history of past history in the same patient to make sure you don't miss a genetic component of a patient with lymphoma, I think, for many diseases that we take care of.